Hi, I'm Dr. James Meschino. Erectile dysfunction and diabetes. Are there any natural remedies or solutions that are useful? Well, erectile dysfunction is defined as a consistent inability to obtain or maintain an erection for satisfactory sexual relations. And complete erectile dysfunction is an inability to have penetrative relations at any stage. So that's like complete impotence, if you will. How common is the problem? About 50% of men by age 50 already have some degree of erectile dysfunction. By age 60, about 75% of men have some degree of erectile dysfunction. Even if it's not complete erectile dysfunction, they have some degree of sexual performance that's being impaired compared to when they were younger, let's say. And diabetics are particularly prone to erectile dysfunction. Why is that? Because diabetics have a greater propensity to clog their arteries up with cholesterol and plaque. So the arteries of a diabetic are more susceptible to higher cholesterol and triglyceride levels. And so it's imperative for a diabetic to keep their cholesterol level down below 150 milligrams per deciliter and their LDL cholesterol below 72 milligrams per deciliter. Using the other units, that would be below 3.8 millimoles per liter, and keep your LDL below 1.8. So your total cholesterol below 3.9 or 3.8, and your LDL cholesterol, the bad cholesterol, below 1.8 millimoles per liter. So keeping your cholesterol down is vital. Also, your blood sugar, when blood sugar starts to rise, it starts to sugar-coat a lot of proteins inside the bloodstream and forms crystals, and those crystals produce an inflammation in the blood vessel wall, which also impairs blood flow. So if you impair blood flow, then the blood going to the genitalia is going to be impeded, and that's how an erection occurs. And for a diabetic, of course, clogging up your arteries increases likelihood of heart attack and stroke and developing gangrene, shutting down your kidneys. So, it has other benefits if you can just play by the rules. And there's related issues. Type 2 diabetics, or adult onset diabetics in particular, are usually overweight and out of shape at the time that diabetes is discovered, because the fat cells, being large, actually produce insulin resistance and actually creates the diabetic condition to a certain degree. So, getting into shape and getting that body fat down is useful. The other thing is that when your fat cells are larger, they produce more estrogen, and the estrogen encounters the effects of testosterone, and that's also going to make it more difficult to have sort of normal sexual functionality if you're a man. Are there some natural solutions to the problem? Yes. So how do you shrink your fat cells down, get your cholesterol down? Some 30 minutes a day of endurance exercise is useful. It increases blood flow through your blood vessels, gets the blood circulating again, improves what's called endothelial function. The blood vessels learn how to dilate again, which is very important to getting an erection. And that exercise will reduce triglyceride and cholesterol levels, reduces body fat, and helps to regulate sugar levels, and will then bring your estrogen levels down as well. You should also eat less saturated fat and trans fats and fried foods. You probably know that. And be careful with sweet and starchy foods. Try to keep your fasting blood cholesterol. Try to get it down to 90 milligrams per deciliter, or 5 millimoles per liter, or as close to that number as you possibly can. That's what's ideal for longevity and for blood circulation. And one of the ways to do that is to have more soluble fiber, because more soluble fiber lowers cholesterol and lowers your blood sugar levels. So beans and peas, and using ground flaxseed and psyllium husk fiber, eating oats, and oatmeal and soy products as an example. That kind of soluble fiber slows the absorption of blood sugar and keeps your glucose levels in a better range and helps to drag cholesterol out of your body. Alcohol makes things worse in terms of erectile dysfunction problems, and of course you can't smoke because that'll really clog up your arteries even faster. But there are some supplements that are really useful and underappreciated that can be used to correct erectile dysfunction problems, even in a diabetic. So I want to touch on some of those natural herbal agents. One of them that I like is called Tribulus terrestris. It's also known as puncture vine. It's an herb that contains these saponins that then cause nitric oxide to be released in the blood vessels around the genitalia, and that allows more blood and engorgement to happen, which gives you a firmer erection and a longer lasting erection. So Tribulus terrestris is a supplement that can be used, as well as what they use in Brazil, which is muirapuama, another herbal agent that's been shown to be a good aphrodisiac, it's sort of a nerve stimulant for the genitalias. It's been listed in the British Pharmacopoeia as a treatment for impotence, so even in medical channels it's recognized as being useful. Studies at the Institute of Sexology in France under the supervision of Dr. Jacques Weinberg has shown that certain supplements that contain muirapuama have improved libido, frequency of intercourse, and reversed erectile dysfunction problems in men. And also Avena sativa, also known as wild oats, so that's where that term came from, sowing your wild oats, increases tactile sensation and increases pleasureful feelings coming from the genitalia. So some recent studies have shown that men using Avena sativa, 22% of them reported an increased sensation from the genitalia, and women also about 15% increased, reported more sensation, and also 29% reported increased frequency of orgasm. So with more sensitivity and more stimulation through the nervous system, that's how you get some of the sexual experience, obviously. And maca root has been used for a long time as an aphrodisiac. And epimedium, also known as horny goatweed, it looks like the way that it's working is by raising the brain levels of dopamine. Dopamine is the neurotransmitter, or the brain chemical, that's tied to pleasureful feelings, including sexual desire and sexual stimulation. So dopamine is, by raising dopamine naturally, you get this secondary effect on sort of sexual function and desire. And of course, Damiana increases the sensitivity of sex organs. So the trick is to get a combination supplement that puts them all together. And because the way that these herbs work synergistically is they then increase blood flow to the genitalia, they increase sensitivity of the genitalia, and they also increase libido and desire by, it looks like, affecting some of the brain chemicals that are related to sexual desire and libido. And these are good for both, not just for men, but also for women who have shown an easier time reaching orgasm when they take a combination of herbs like this. So clinical studies have shown the efficacy and the safety of doing these things. There are some dangerous supplements that I want to point out to you, because if you take, even though they can work to improve erectile dysfunction, there's a risk of bleeding disorders or some other types of toxicity that I want you to guard against. So the way that you can really get this figured out for yourself in an easy little game plan is what I've done is I've created a little ebook that's available right here for free. It's called Effective Natural Remedies for Sexual Performance and Libido, a Guide for Men and Women. You should download that ebook right now, read it through. It's all explained there, all the scientific references are there, and you'll see exactly how to put these things together in a little sort of supplement cocktail to give you the best chance to overcome erectile dysfunction problems, using the safest and least toxic means available. So some natural herbs which have been really underutilized over the years can really make a big difference. Now at meschinohealth.com you'll see my other research review papers, other videos I've created, footage from my live professional seminars, other videos and resources that I've put together. They're all there for free. And they're designed to help you lead a long, healthy, functional life. Not just to be alive, but to really have a functional life as you get older on all levels, both body and mind. And all the research papers and teaching materials that I have there are complete with all the scientific references, so you'll see you're getting only sound scientific evidence-based information from me, not just a bunch of theoretical information. You're going to see where the information comes from. So if you're looking for any health or wellness topic, you should really make Meschinohealth.com an ongoing, reliable resource for both you and your family members. Thanks so much for watching.